大家都看到我的 screen 吗？
有的。
我能看呢。
All right, so start now. OK，那我们现在开始咯。我这边会先做 record，那么还没有到的呢，我们也会发这个 recording 给他们。All right, good evening, everyone. Yeah, can you please say hello to me in your chat box? A special warm welcome to our Indonesia team as well. We are very happy to have you all joining us tonight. Thank you all for being here. And today's training is very, very important to us because we'll be learning how CyberKnife can help cancer patients, especially in terms of precise and non-invasive treatment. And yes, we are very honored to have Dr. Yang Jun with us tonight. He's a founder and director of Fosan CyberKnife Center and has handled over 6,000 CyberKnife treatment cases. Wow, I believe tonight's section will help all of us to understand this technology better and allow us to support patients more confidently and professionally. Over to you, Dr. Yang Jun.
Okay, thank you very much, Evelyn. So it's so glad and honored to be here. Can everybody hear me okay?
Yes, very clear.
Excellent. So today we are going to use the next 45 minutes to talk about robotic radiosurgery. The robotic radiosurgery is one of the best technology that's available to treat cancer, but in a different way compared with the conventional radiation therapy. As we all know that there are three major ways to treat cancer. One is surgery. The other one is medicine, the drug. The third one is radiation. In the last 20 years, radiation has changed completely from conventional radiation to ablative precision radiation. We call the radiosurgery. Radiosurgery, kind of like a knife, but it's not a bleeding, no pain. So in today, my talk will cover three sessions. The first one, we're going to play a quick video. As such, you will understand what the CyberKnife is quickly. Then I will talk about the technology of the machine. Number three, I will talk about the clinical application of a CyberKnife. So let's get this started.
她是我学妹哎。
Let me pause it. Can you guys hear the video and see the video? I'm playing video now. I assume that's yes. Okay.
We can see, but we actually can't hear any sound.
The CyberKnife system.
Let me pause it. Can you guys hear it? Can you guys hear the video? Hear the audio and see the video?
Is the world's first and only
yes,
robotic radiosurgery.
Yes?
Yes.
Good. Okay. Let me go back a little bit.
System is the world's first and only robotic radiosurgery system. This technology brings the benefits of radiosurgery to the treatment of tumors anywhere in the body. It provides a pain-free, non-surgical alternative for patients, including those who refuse surgery or have been diagnosed with surgically inoperable or complex tumors. CyberKnife treatments are done on an outpatient basis and do not require anesthesia or invasive stabilizing frames. Most patients can return to normal activities almost immediately following treatment. The CyberKnife system uses continual image guidance and computer-controlled robotics to precisely deliver high-dose radiation beams from virtually any direction with sub-millimeter accuracy. This unhindered mobility minimizes damage to surrounding healthy tissue and nearby critical structures like the spinal cord. The CyberKnife system is a dedicated robotic radiosurgery system. Unlike conventional radiation therapy, which delivers low-dose radiation in 30 to 45 treatments, CyberKnife radiosurgery delivers high-dose radiation in as few as 1 to 5 treatments. The CyberKnife system can be used as an alternative to surgery, unlike radiation therapy, which typically serves as an adjunct to surgery. Unlike other systems on the market, the CyberKnife system images continually throughout the treatment and automatically corrects treatment delivery for even the slightest tumor or patient movement throughout the body. This unique ability is important for treating tumors that move, particularly those in the spine, lung, liver, pancreas, and prostate. Unhindered by the clockwise-counterclockwise constraints of conventional gantry systems, the CyberKnife system's robotic mobility has significantly improved dose sculpting capabilities and conformal dose distributions. Prior to treatment, the patient is imaged using a high-resolution CT scan to determine the size, shape, and location of the tumor. Following the scanning, the image data is digitally transferred to the CyberKnife system's treatment planning workstation, where the treating physician identifies the tumor to be targeted and the surrounding vital structures to be avoided. The CyberKnife software then generates a treatment plan to provide the desired radiation dose to the identified tumor location. Finally, during a CyberKnife procedure, the patient lies comfortably on the treatment table, which automatically positions the patient. Treatment generally lasts between 30 and 90 minutes. Prior to the delivery of each beam of radiation, the CyberKnife system simultaneously takes a pair of X-ray images and compares them to the original CT scan. This image-guided approach continually tracks, detects, and corrects for any movement of the patient and tumor throughout the treatment to ensure precise targeting.
All right. Sorry, it's a quick video. I think it's just give you guys some initial concept of CyberKnife. So now I'm switching to the part 2. Start to talk about the technology part of CyberKnife. As such, you understand what this machine looks like, and what is the first thing first? What is radiosurgery, and what is a CyberKnife? So radiosurgery is one. It means it has many small beams converged on a small target, and the dose is very high. It's so-called ablative. Traditionally, like a gamma knife or 陀螺刀, traditionally it was one treatment. Now CyberKnife can do 1 or 2 or 3, all the way to 5 or even 10 treatment. And the dose is very high. It can ablate the tumor. That's why it's called radiosurgery. Conventional radiosurgery, radiation therapy, it will treat the tumor in the box, but the tissue, let me make sure you can see my mouse. How do I make that happen? Sorry, let me hold on a second. I hope you guys can see my mouse, right? So basically, when we are treating the tumor in the center, and the tumor in the center is getting 2 gray times 10, 2 gray every day for 10 days. But the tissue, that's where the beam goes through, got 1 gray times 10. So the tissue got a lot of dose. That's a problem with conventional radiation therapy. With radiosurgery, that's different. Instead of giving 4 beams, now we are giving, we are giving more than 100 beams. So every beam is very, very weak. Every beam only carry 1% of radiation. When we give a tumor 20 gray, the normal tissue only get a 0.2 gray. So tissue get very, very low dose, and tumor get very high dose. That's why the tumor gets ablated, but the tissue is still safe. Why will that matter? Because the conventional radiation, like yellow, we give a 2 gray in by 10 days, and every day we kill this much tumor. If we give a 20 gray in 10 days, versus in radiosurgery, we give a 20 gray in 1 day, we kill 150% of more tumor cell. That's the power of the radiosurgery. So giving the same dose in short amount of time, we could actually kill we could actually kill more cancer cells. So on the left side is we call the conventional radiation therapy. On the right side is the CyberKnife. And you don't need to be a doctor. You can tell the difference. So conventional radiation, when they treat the bone, when they treat the tumor in the bone, they give also a lot of doses to the bowel. So, and they take them 10 days to finish the treatment. And verse on the right side is a CyberKnife. You can see there's a big tumor. The tumor already enrolled into the bone and it causes a lot of pain. So the red line is the tumor's contour. The yellow line is the radiation dose that's delivered by CyberKnife. And it's a much quicker treatment. It only takes 3 days, and it has a 95% chance to kill this tumor without pain. Again, no pain, no bleeding, no anesthesia. It's quite straightforward. That's radiosurgery on treating the bone. So conventionally, there's a gamma knife used for treating the brain tumor. And people like us, we also use the linear accelerate to do the radiosurgery. And when you use the gamma knife or when you use the linear accelerate, you actually need a frame to screw the frame in the patient's body, which is very, very challenging because it costs a lot of pain to do that. To do the body is not ideal either, because even you use the body frame, to immobilize the patient's body, but the tumor inside the body is still moving around. So this is a problem with the gamma knife and also with the linear accelerate. Now we talk about the CyberKnife, which overcome the problem that the CyberKnife Linac has. So this is what the CyberKnife looks like. In the older CyberKnife looks like. It's a small linear accelerator is here. Is moved by this robotic arm. This robotic arm has 6 joints, and which means it could carry the Linac radiation sources to irradiate the tumor from any directions at any precision. It's very, very flexible. It could shoot the tumor from anywhere, right? And also with all the directions you need. On the top of the ceiling, you also have 2 X-ray sources. And these X-ray sources will image the patient. So instead of like a gamma knife, instead of put a screw in the patient's head and immobilize the patient, CyberKnife does not do that. CyberKnife uses imaging to track the patients. So this is the linear accelerator, and it's very fast. The small collimator is 5 millimeter. The largest collimator is 60. It has 12 different sizes. And this is a robot joint. This robot has 6 axes, 6 joints. That means 6 freedom. You need 3 freedom to move this to move the Linac to any direction you need. You need another 3 joint to point a radiation beam to any direction you need. So with the 6 joints, which means you can shoot this radiation to anywhere with any direction you want. That's the huge benefit this robot offers. And in any plan, the robot, there's a virtual sphere. The tumor is in the center of the sphere, and the robot will only stop by at the nodes that are evenly distributed on the surface of this virtual sphere. And there's totally 120 nodes. So the robot will stop at node 1, then go to node 2, node 3, and node 4, all the way to node 120. At each node, there are up to 12 directions available to treat one tumor. As such, in total, there are 1,400 beams available to treat the tumor. It's a huge number. Now with the new CyberKnife, there are about 4,000 beams available to treat a tumor. And this is the table. This table holds up to 160 kilogram patient's weight. And so in America, there's many heavy patients, but in Asia, this is typically big enough to treat we don't see many patients bigger than 159 kilogram. Even if patients are bigger than that, we still could treat it with the CyberKnife. This is the X-ray. On the ceiling, that's X-ray sources. On the bottom, there's a panel. So during the treatment, every second, basically every 20 seconds, this machine will automatically do imaging, and this imaging will tell the robot where the patient is, and the robot will correct for it. So basically, the machine will have 4 tracking method. One tracking method is using the skull, use the bone to find out where the tumor is. So when we treat the brain tumor, we use the skull tracking. When we treat the spine tumor, we use the spine tracking. By finding where the spine is, we will treat the tumor. And when there's a soft tissue tumor, we will put a gold fiducial into the tumor ahead of time. So this is during the treatment. This is what the therapist see. Therapist on the left side, that's the reference X-ray. That's the CTs that's used as X-ray. In the middle is real-time X-ray. On the right side is the overlay of the X-ray. So the software will automatically calculate and tell you how much the patient is off. For example, in this particular second, and the X-ray found out the patient is off to the right side, 1.7 millimeter, to the posterior, 0.6 millimeter, inferior, 1.9 millimeter, and also tell you how much the rotation is. On the right side row is a 0.6 degree, counterclockwise, 0.2 degree. So the software is so smart. By taking the 2 X-rays, it will tell you how many millimeters the tumor is off. Remember, we have a robot. Robot will correct this error. Robot will move 1.7 millimeter to the right to correct for the tumor and to track the tumor. So it's really great technology that we can use. So in the past, if you use a LINAC, most of the time you have to do breath holding. Or gating to treat the tumor. And the CyberKnife is the only technology. Sorry, let me see if I can play with. No mind. Oops. Oops, sorry about that. CyberKnife is the only technology that can track the tumor. What does that mean? So give me a second. Sorry about that. So when we treat a brain patient will move a little bit. But the most challenge is when we treat a lung patient. The lung tumor will move when patient breathes. And the CyberKnife is the only technology that can move with the tumor. What it does is it takes X-ray. It takes X-ray and capture the tumor's motion in real time. And then the machine will follow the tumor and treat the tumor accordingly. So this is the animation for the lung tumor and show you how the tumor is moving. Hold on. So now let's talk about what CyberKnife can do for our patient. In the older time, you have on the top three, you have a very old machine. These days, on the bottom, you have a linear, you have a state-of-the-art linear accelerate, and also we have the CyberKnife. We already talked about this, right? We already talked about this. So this is a typical example of old conventional radiation to the left, comparing with the CyberKnife to the right side. In older time, when we try to treat the lung tumor, we will damage a lot of tissues. Versus these days, with radiosurgery, we focus on the tumor itself. This is the prostate cancer as well. You see, when we do the MRT on the left to the prostate, we only have 80% of a local control. With the prostate SBRT using CyberKnife, only 5 treatments instead of 40 in conventional radiation. Only 5 treatments. The low risk patient survival is almost 100%. Basically, the red is the tumor. The white is the dose delivered by CyberKnife. And you already see this spinal case before. So on the left side is the conventional radiation. On the right side is CyberKnife. So this is the CyberKnife comparing with other radiation. This on the left side, the conventional radiation treating lung cancer. This is the CyberKnife in the middle. On the right side is the proton therapy. And you can see from this picture, proton therapy proton therapy is actually as good as a conventional therapy. However, may not be ideal for lung cancer. Is probably not as good as the CyberKnife, as the SBRT. So this is what you can see. So comparing with conventional radiation therapy, CyberKnife treatment only take 1 to 5 treatments, 1 week. And versus conventionally is 7 weeks. Every time is give 200 units. And the accuracy is 3 millimeter in conventional radiation therapy. And it takes a long time to cover, it's more toxicity versus CyberKnife because its precision is a 0.2 millimeter precision. It's the toxicity is very, very low. So in general, CyberKnife has a very short treatment time, higher treatment precision, and a few side effects comparing with the conventional therapy. So this is a real case that we treated in Philadelphia, in America many years ago. On the left side is a linear accelerator without gating. In the middle is a linear accelerator with gating. And on the right side is a CyberKnife. Again, you can see the color is a dose, right? In the center is a higher dose. The brown is a middle dose, and the green is a low dose. And you can see that all the doses is much smaller to the surrounding tissues in the CyberKnife on the right side. It spares a lot more normal tissue. In short, CyberKnife has a higher precision and fewer side effects. So this is the CyberKnife. Again, it's moving with the tumor on the left side. And the pictures in the middle mimic a tumor's motion with the lung tumor's motion. So in the LINAC treated tumor without gating is the big one, had a bigger green circle. So it treats not only the tumor, it also treats a lot more surrounding tissues like the lung. Versus the gating that you also treat a lot more tumor. CyberKnife is the only one that tracks tumor's motion, that tracks tumor's motion in real time. That's why CyberKnife is a much better technology, sparing the tissues and give a higher dose to the lung tumor. So what happened when we treat? How do we use the CyberKnife? And here, basically, you can see this is the early stage lung tumor. You know, these days, many patients have a lung nodule, right? When the lung nodule is larger than 8 millimeter, we need to treat it. Conventionally, we treat with the surgery, and we have to cut the patient open. We have to take a big chunk of lung tissue out, and it's a lot of challenge. And the verse here, the red is the tumor, the white is the dose to the with the CyberKnife to cover the tumor with a 5 millimeter margin. With a 5 millimeter margin, we want to treat a 5 millimeter margin because we want to make sure the microscopic disease is also treated. Not only the tumor being treated, but also the cell, the cancer cell surrounding are treated as well. And this is what we see. In this case, we will give a 5 treatment to treat this lung patient. Every treatment is 20 to 25 minutes. And there's no pain, no bleeding, no anesthesia. So every day, patient can stay at a hotel. And they come to treat for 25 minutes. Then go ahead and play tennis, go ahead and play golf. And as soon as they finish treatment, they could go back to the normal life. Oh, by the way, when we treat the early stage lung cancer, we have a 98.4% of local control for early stage lung cancer, as good as surgery, but much less side effect as surgery. Again, this is show you to the left, the CyberKnife for tracking the tumor, versus with the LINAC, CyberKnife treating much larger volume than CyberKnife. Okay, CyberKnife also treats a brain tumor. As we all know that 40% of cancer patient will eventually develop the brain mets. The tumor will go to the brain. On the left side is an easy case, right? You only see one brain met, small 1 cm brain met. In the past, we have to treat the whole brain, and it costs a lot of side effect. It could take 10 days to treat. Now with the CyberKnife, many times we only need one treatment. I just need one treatment, 25 minutes. And we do not treat the whole brain. We just treat the tumor itself, and the patient go home right away. So the president of the United States, the President Carter, got the treatment just like this, very quick and easy. Now you see in the center, you see another case is the most complicated. That's the tumor in the brainstem. That's a patient in the brainstem. The patient has another tumor in the brain. So CyberKnife can treat the tumor in 3 treatments. Each treatment is 25 minutes. And we can treat these 2 tumors together. Remember, the tumor in the brainstem is very difficult for surgeon. You cannot perform a surgery for the tumor like this, and we can easily do CyberKnife. On the right side is another complicated cases. With 5 treatments, we can ablate this tumor easily, and just within 1 week. You do not need 5 weeks anymore. Just 1 week, we can get this tumor treated. So basically, it can literally save the life with the CyberKnife. Again, very minimum side effect. How about the liver tumor? Liver tumor is also very good application with the CyberKnife. On the left side is a very small tumor. We call it small liver cancer. And when the tumor is so small, we try to ablate the tumor. We try to cure this patient. So when the liver cancer is less than 5 cm, our goal is to try to cure this patient's cancer. So with the CyberKnife, remember the liver tumor also move with respiration, and the CyberKnife can move with this tumor as well. With 1 week, we can have a 95% of chance to cure this small cancer, liver cancer. So on the right side is the complicated cases. It's much larger. The tumor is about 13 centimeter, and also the next to the bowel. And we could also easily treat this patient, and we're going to use 5 treatments to treat this tumor. Prostate cancer is a huge application for CyberKnife. Today, I actually prefer to do CyberKnife than surgery to the prostate cancer. Why? You can see the red is a prostate tumor, the yellow is the dose, S-dose line is very, very conformal to cover the prostate cancer. And in other words, only with 5 treatments, you do not need to perform a surgery to treat this prostate cancer. The patient still keep the sexual function. And for low risk patient, prostate cancer patient, we have almost 100% local control in 7 years. For intermediate risk, we have a 94% local control in 7 years, and a very low side effect. So, but if you do surgery for the prostate patient, and the local control is only 90%, the surgery's local control is not as good as the CyberKnife, and also a lot more side effect. This is the spine tumor. Again, 30% of a patient will develop spine metastatic diseases. CyberKnife is so powerful that we can treat the bone, the vertebral body, at the same time spare the cord easily. So on the left side is easy case. We only need to treat 1 vertebral body. In the middle, we need to treat 4 vertebral bodies. It's very, very complicated. On the right side is the most complicated cases. We treat 3 vertebral body. We spare both cord and also the nerve. So it's very complicated cases. But the CyberKnife, thanks to the robot, is so flexible. It's so flexible. We only treat the tumor. We can spare the cord and also the nerve. We can spare the normal tissue. So clinically, there are more than 10,000 papers already been published, and all has shown excellent clinical outcome. For spinal tumor, many paper reports 90% local controls. For prostate paper, published by Memorial Sloan Kettering, the best cancer center in the world, it shows 97% of the local control.
哦，咖啡灌肠，你要跟他们讲咖啡灌肠。
Versus conventional radiation, only 89%. So what this means? What this means? CyberKnife in 1 week has 97% of rate of success. Conventional radiation takes 7 weeks, only have 89%. And the surgery is even worse. Surgery is even worse. So on the right side, the early stage lung cancer, the small lung nodule. This is the data that is published by MD Anderson in America, the best cancer center, of course, in the world. You can see for lung cancer, CyberKnife has better survival than surgery. CyberKnife has better survival than surgery. It has the same local control, but survival is higher. Why? Because the CyberKnife has much less side effects. So when we have an older patient, when the patient cannot tolerate surgery, the real surgery, or patient does not want the real surgery, we could definitely offer CyberKnife. So clinically, what CyberKnife do? We can use the CyberKnife to treat a brain tumor and head and neck cancer, including the brain mets, including GBM, the primary brain tumor, trigem neuralgia, the pain, right? The pain, AVM, etc. And many times you may have a patient had a gamma knife, had a linear accelerated radiation before, and the tumor come back, and then you can still come to us to get a re-radiation with the CyberKnife. For lung cancer, as I mentioned, you can treat early stage lung cancer or late stage lung cancer. Or the patient may have a metastatic disease to the lung. For example, the patient may have a breast cancer. Breast cancer being treated, but you have a metastatic disease to the lung. Guess what? We can also treat with the CyberKnife. So we can treat liver mets, and we can treat primary liver. We can treat pancreatic liver. We can treat spine tumors and the prostate tumors and many other tumors. So basically for almost all the solid tumors, and except for the esophageal cancer, for the bladder cancer, and the stomach cancer, except these 3 cancers, almost for all other cancers, there's opportunities that we can treat with the CyberKnife. So basically, CyberKnife had been approved in 2001, and so I started CyberKnife in 2003. I'm one of the earliest guy using CyberKnife in the world. And in 2006, I moved from Miami to Philadelphia. I co-founded the Philadelphia CyberKnife. And in 2013, I became the chief physicist and chief scientist for Alliance Oncology. At Alliance Oncology, I manage 16 CyberKnives. And in 2015, I started to draft the guidelines for QA quality control guidelines for CyberKnife in United States. In 2020, I went back to China. I feel that CyberKnife helped. I have used CyberKnife helped about 6,000 American cancer patients. I feel this is wonderful technologies. I should use this technology to treat Asian patients. That's why I moved back to China in 2020. And in 2022, we bought our own CyberKnife in Foshan, in Guangzhou, in China, and which is one of the very premium cancer CyberKnife center. And by the way, our CyberKnife center become a training center for Asia. So all the new CyberKnife users in China, in Southeast Asia, if they are doctors, they are physicists, will come to my center for training. It had been seen Warren Buffett had prostate cancer, and Steve Jobs had pancreatic cancers. Both of them had CyberKnife treated before. So this is our center in Guangzhou, and the hospital is a JCI certified hospital, and we speak English and of course Chinese and also Cantonese in the hospital. And also this hospital happened to be the #1 ranked private hospital in China. And we have more than 100 doctors and staffs in this center to treat cancer patients. And today we treat about 2,000 patients with radiation every year. And we are the only one institutional members of Radiosurgery Society in Asia. So Radiosurgery Societies has thousands personal members, has 14 institutional members, including MD Anderson, Stanford, Montefiore, etc. My hospital is the only one in Asia become institutional members. And also we do a lot of researches. We published many papers, including we won the Best Paper Award at the Radiosurgery Society in 2023. And joining me, you also see Dr. Cui, who are very famous in China. Dr. Gang Ye is a medical oncologist, practiced in United States for 40 years. Then he joined us in Foshan. Dr. Han is a very well-known radiation oncologist in China. Dr. Enming Wang is the #1 radiosurgery guy in China, and he treated more than 20,000 radiosurgery patients to the brain, and very respect. So all these doctors are full-time employees, doctors. They are not a consultant. They are full-time employees joined our team in China. So basically, our goal is to give every cancer patient hope. We want them to know that with the CyberKnife, with the best technology, cancer is no longer the death, detrimental diseases. We are converting cancer to a chronic diseases with the new technologies. So this is also I can show you some clinical cases. This is acoustic neuroma. Every light blue line is the real beam that's shooting through the body and intersect to the acoustic neuroma. Guess what? We have a 98% chance to control this acoustic neuroma and also help the patient to keep the hearing. The patient can still keep the hearing. This is the brain meds. This is the spinal meds. The patient is already paralyzed. The patient cannot move anymore because the tumor is pressing the cord. However, after we give a 5 treatment, patient can start walk again. And so we basically with this we treated many patients like this, and this is nasopharyngeal cancer. This is a very tough case. This is not with CyberKnife. This is treated with conventional radiation. With 7 weeks radiation, we can see this the squamous cell carcinoma to the brain. After 3 treatment, after 10 treatment, after 30 treatment, the 90 years old ladies cancer get cured. This is the pancreatic cancer. This is the before treatment. This is the after treatment. This is the brain mets, single brain mets, and for 40 years female, and with the 3 treatment, the tumor is gone on the right side. This is the lung tumor before the treatment, and this is 3 months later, all the tumor disappeared. This is the rectal cancer. This is after the treatment. It's a 5 treatment. This is another brain mets, and the patient cannot walk. After the 1 week treatment, the tumor completely disappeared, and the patient started walking and go back to real life. And this is the breast cancer patient with multiple brain mets, And you can see the patient has many tumors, and we give a whole brain radiation, and we also use the CyberKnife to boost. And you can see the tumor, all these 25, maybe 45 tumors completely disappeared. And the patient it's called a CR, means a completed response, and the patient get back to normal life. This is the 1 early stage lung cancer for the male 64 years old T1N0M0 squamous cell carcinoma. We gave a 3 treatment with CyberKnife. This is 3 months later. This is 1 year later. This is 5 years later. The tumor is completely gone. There's only a little fibrosis of the lung. The patient come back to the normal life. And 5 years later, patient's alive. 10 years later, patient still alive. This is the difference. This is the latest stage lung cancer, T4N0M0. So basically, we give a 7 treatments, and 3 months later, the tumor is completely gone. The patient is doing well. This is another huge tumor. The tumor is a stage 3, 13 cm tumor with a CyberKnife, and after 5 treatment, the tumor disappeared. And again, this is a small lung tumor, and after 5 treatment, tumor completely gone. This is the breast cancer patient. We treated the breast holding, and we can protect the heart really well. So conventional radiation, when we treat the breast, you can see that's what you commonly see. The patient tumor had red skin, and the skin also being damaged. And on the lower end is our breast patient. The patient's skin has a very minimum toxicity compared with the conventional radiation, because we give a very high precise radiation. And this is another case that we treated. The patient has a spinal mass, and the patient is already paralyzed. And after 5 treatment, patient come back to walk. This is another patient paralyzed, and after we treat 5 days, 2 weeks later, patient start to walk. And this is a 9 cm tumor. After treatment, tumor shrink to 7 cm in 1 month, and 4 cm in another 3 months. So basically, we have many exciting cases that we treated. Many cancer, very scary, but with the conventional, with the CyberKnife, you can easily control this tumor, and no matter where it is, no matter it's in the head and neck, it's in the liver, it's in the pancreatic cancer, it's the lung, no matter the large tumor or small tumor, no matter it's sarcoma, lymphoma, we can easily treat them. We have so many treatments, so many cases available that to treat. So I just want you to be aware that the cases you see today is the real case that we treated, we offer to our patient every day. And today, in our cancer center, our patient survival is as good as America and the European countries. Is better than a little bit better than China's. And that's something I want to mention, number one. Number two, in China these days, we have so many different cancer drugs than other countries, because China has many pharmaceutical companies. They have a lot of scientists to research on these drugs, and we have more drugs than most of other countries in the world, and also they are very cheap. The cost is only 10% of American's drug. So so we have top doctors, top surgeons, top radiation oncologists, top medical oncologists. One thing I want to mention is when the patient comes in, we typically have 3 doctors, maybe even more, to see this patient together. And we have a medical oncologist, a radiation oncologist, and a surgeon, and also nurses. We have 4 professionals to see one patient at the same time, offering multiple disciplinary treatment to this patient. I think that's another huge advantage we have to offer the treatment for you. All right, so I think I'm sorry, it's very dry, but it's sometimes it's a complicated concept, and I hope you get some idea of what we can do with the CyberKnife, and I hope we can meet in person one day, either in Malaysia or in Guangdong in China. All right, I'm going to stop here, see whether you have any question for me.
Thanks, Dr. Yang. Not dry at all, very informative. Guys, do you have any questions? If anyone has questions so far, feel free to type in the chat box here. Or you can just open your mic. You can just unmute. Okay, Dr. Kenny has a question.
So yeah, Dr. Kenny said, if there's abscope effect, so the dose must be high enough. That's absolutely right, Dr. Jan. So what is the abscope effect? So many times patient has more than 1 tumors, right? When we treat 1 tumor with a CyberKnife with a high dose, and the cancer cell will die very quickly and release neuroantigens. The neuroantigens will stimulate the antibody, will stimulate the patient's immune system, and then the patient's immune system will kill other cancers. So basically, when patient has 1 tumor with multiple tumors, when we treat one, the other tumors also disappeared or shrinked. This is called abscope effect. It's an amazing effect that is the best thing ever happened. This only happened to CyberKnife or radiosurgery that have a high dose every day. And conventional radiation does not have this happen. Conventional radiation does not have happen. So Dr. Kenny Yan had a really good question. I hope I answered the question. So okay, so Bernice asked which generation of CyberKnife machine this is, and which generation Malaysia has. So CyberKnife has 6 generations. Number 7 is the same with the number 6. So we normally call 7 the same as 6. So we have a generation 6, and we checked some of Malaysia's CyberKnife. We believe Malaysia has 1/3 generation. May have another 6 as well. We believe Malaysia has 1 or 2 CyberKnives, and one is generation 3, the other one is number 6, but we have not seen the number 6 yet. And also, we believe we have probably the most experienced doctor in the world in our using CyberKnife in our cancer center. So it's not only just the machine, it's also the doctor that we have more with Dr. Wang, with myself combined, we probably treated more than 30,000 patients with the CyberKnife, more than anybody else in the world. If a patient had prostate cancer, did the SBRT still suggest CyberKnife? Yes. If a patient has a prostate cancer, we strongly prefer SBRT than surgery. Prefer SBRT over conventional radiation. Okay, when SBRT, there's two type of machine can do SBRT for prostate. One is a high-end LINAC, the other one is a CyberKnife. And right now, the publication already show CyberKnife has less toxicity than LINAC-based SBRT. So CyberKnife is more precise, has less toxicity. Why is that important? Because the prostate patient going to live 10 years, 20 years, 25 years, right? So we need our patient have a good quality of life. We can treat, we can cure this patient. We also need to make sure the patient has a less side effect. And the CyberKnife treating the prostate has less side effect than linear accelerate. How CyberKnife can help in early stage breast cancer? That's a great question. So traditionally, right now, when the patient has early stage breast cancer, so we will do surgery first, no matter what. Then we will treat the whole breast with a linear accelerator. We treat the whole breast with a linear accelerator. However, for early stage breast, we can treat with radiation with a CyberKnife as a partial breast, which means we do not treat the whole breast. We only treat part of the breast. By doing that, we give less dose to the heart, less dose to the lung, we have less toxicity, and also even the breast, the skin has less color change. So basically, if we have a very early breast cancer, we can really treat the breast after surgery with almost zero toxicity to the heart, to the lung. Again, breast cancer patient lives a very long time. Our patients, our stage 1, stage 2 patient, 5-year survival is 100% in China, in our cancer center. So this patient is going to live another 10 years, 20 years. We do not want their heart, their lung get damaged from this treatment. And 5 years down the road. So the CyberKnife can spare a lot more than linear accelerate. So I think Dr. Kenny Young said, in Malaysia, many hospitals have many CyberKnife. Malaysia may have many CyberKnife, but we have the latest, newest CyberKnife. But is this true? M6 the latest? And yes, there's a new model called S7. S7 is exactly the same as M6. It's just a little change on the color, so it's the same. So for 5 days, and how much the cost is rigging, and is this cheaper than Malaysia? Oh, that's a great question. So typically, I believe our CyberKnife cost is much cheaper than America. Is probably, I don't know. I think is I don't know. Maybe our staff could help. Evelyn, whether you can comment that. I believe our CyberKnife treatment is cheaper than Malaysia's CyberKnife, and also our doctors has a lot more experience. Anybody could comment on that? Okay, then another question is, what's the side effect? Will patient get has hair loss, weight loss, no appetite? No, mostly CyberKnife side effect is much, much lower than conventional radiation, is also much lower than chemotherapy. Of course, it's going to be much lower than surgery. CyberKnife patient will not have hair loss, will not have weight loss. And most likely, if the patient will feel tired, fatigue, will feel fatigue. The fatigue will go away in 2 weeks because their body received radiation, so they will feel a little bit tired, but they will get recovered within 1 to 2 weeks. So it's very safe and very low side effects therapy. However, CyberKnife still has side effect. That's never say never, right? It's never zero. It still have a little side effect. When we treat a brain tumor, the patient have a little edema. When we treat a spine tumor, the cord could be damaged. That's why it's not just the machine. You also need good doctors, good people, good clinical experts to use CyberKnife to treat the patient. Renal cell cancer, wow, large, 11 cm. Thrombosis is safe to fly to your cancer zone. Yes, for renal cell cancer, renal cell is not sensitive to conventional radiation. However, renal cell is sensitive to CyberKnife, high dose radiation. When this is a big renal cell cancer, we have a special strategy using CyberKnife. We will treat the center part of the renal cell called SCOT technology. That's invented by me, and we have a 95% chance to control this renal cell, 11 cm cancer, 11 cm renal cell tumor. Yes, I don't know whether the patient is safe or not, because it depends on the patient status. If the patient walkie-talkie is healthy, yes, patient can fly to our center, get treated. And if patient is very, very, very sick, and then we will recommend patient to recover first, maybe to stop chemo first, and rest for 1 week or 2 until the local doctor evaluate the patient, feel the patient is safe enough to travel. Then it's a 4 hours flight from Malaysia to Guangzhou. So another question is, can I ask if patient no longer need, if a patient no longer need chemotherapy or other treatment? And well, that depends. That depends is if a patient had early stage cancer, such as lung cancer, early stage lung cancer, if you use CyberKnife, then the patient no longer need chemo. However, if a patient had a later stage cancer, that means there's already the chance the cancer cell already goes to other places of the body. Then you need a tumor to treat you still need a CyberKnife to treat the tumor you can see on the CT, on the MRI, on the PET CTs, right? You need a CyberKnife to treat that. However, you still need a chemo or target therapy or immunotherapy to treat the cancer cell that you cannot see on the imaging. Somebody is so nice. They said, only we can best use the CyberKnife. We appreciate it. I really believe we are the top 3, maybe the top 1 CyberKnife team in the world using the machine. Is that important to prime patient to optimize the immune system and prime patient prior CyberKnife? That's a great question. So these days, number 1, we will recommend the patient you could have a NK cell therapy, or you can have a PD-1, PD-L1 immunotherapy. Then you have a CyberKnife, and you wait another 7 to 10 days, as Dr. Yang suggested before, and then you give another immunotherapy. So yes, so it's good idea to prepare the immunotherapy prior or after or both CyberKnife. If you have to choose one, You typically do CyberKnife first, then you give immunotherapy 7 to 10 days after. That's going to be best to maximize the immune response. How long the patient need to follow up? Well, it depends. Some to see the tumor shrink, right? Tumor response completely. Some tumor shrink dramatically very fast. Within 1 week or two weeks, tumor disappeared. But some tumor it may be there for 3 months, but slowly shrink. Some benign disease like acoustic neuroma, pituitary tumor, it takes years to shrink. It takes years to shrink. Doctor, if you already SBRT the prostate cancer, however recurred, would you still do CyberKnife for the same lesion? Possibly. If this prostate cancer recurred after SBRT, and after 1 year or 2, we will do PSMA PET, which is a special PET CT. The special PET CT will tell us where is the recur, and we will use the CyberKnife to treat it. And this is possible. So can CyberKnife treat MT, inflammatory fibrostic tumor? It's again, this the tumor that is not sensitive to conventional radiation. However, it will be sensitive to CyberKnife. And its head and neck, yes, we could treat it. We could. This is a very challenging tumor. However, just for you know, for early stage cancer, our goal is to cure this patient. However, if the patient is late stage cancer, our goal is to give a patient quality of life, at the same time to prolong the patient's life. You know, if the breast DCIS means very early stage cancer, can we treat a CyberKnife without operation? We can, but we do not recommend. Right now, it's too early to do that for very, very, very early breast cancer, because it's very easy to do surgery. It's very easy to do surgery. So just let the patient do surgery, and we give a CyberKnife after. Simple and easy. Only when there's a very, very old patient does not want surgery, yes, we will offer CyberKnife for breast DICS. So anyway, I think there's how effective is the CyberKnife for cervical cancer? How many sessions are you really need? That's interesting. That's a very interesting question. For cervical cancer, basically we treat a lot of cervical cancer with CyberKnife, and particularly for cervical cancer that recurred. Typically we give 5 treatments for cervical cancers, and actually my partner Dr. Lanciano in America, she published a lot in treating cervical cancers with the CyberKnife. So we actually have a lot of experiences of doing that. Let me show you something. Sorry. Hold on a second. This is basically I hope you can see my screen. This is using CyberKnife to treat GYN cancers, women's cancer that is recurred. That's the recurrence. So with the spinal recur. So basically you can see on the 2 pictures. We have 80% local control for 5 years. 80% local control for 5 years. And we have a 60% survival for 5 years. 60% survival for yes, for GYN cancers. This is Dr. Lanciano's my partner's basically that's my partner's talk. And let me see, back in 2000 basically in 2017. But anyway, we just have so many patients doing very well. It's just amazing. It's just amazing how patients respond to our patient. Let me see. Anyway, so I just want you guys to have some idea, because almost all the cancers you see, we have a way to treat with CyberKnife. This is the brain mets. Forget it. We have too many. Oh, by the way, I also want to mention, many of you guys may have a patient recurred after conventional radiation. So this is the patient recurred. This is the American patient. They have a conventional radiation and recurred, and we will retreat with the CyberKnife. Remember, many hospitals will not feel comfortable to treat with radiation again, but we are very comfortable to retreat lung cancer that's recurred after the conventional radiation. And this is our data. So the patient had lung cancer, got a surgery, conventional radiation, and recurred. And we still retreat. We treated again with the CyberKnife. You can see basically patient's local control is 80%. Local control is 80%. And up to 2 years, 1/3, 37% of patients still survive. That's a good question. After CyberKnife treatment, will CTC become 0? If so, how long become undetectable? I actually don't know, because right now it's too we do not routinely check the CTC, circular the cell. So we don't know yet. However, I hope we can work together in the future. We can treat with the CyberKnife, and you follow with the CTC and see how soon the CTC will decline. Normally, we will see the CTC decline quickly. Okay. So anyway, that's I think this is. I hope what I just shared with you makes sense to you guys, and we just treated so many patients. We just treated so many patients in China. We feel very proud of ourselves, and we think we are changing. We think we are changing the world. This is SBRT to the. Oh my God! This is SBRT to the liver. I don't think we need to go through that. It's just way too much. It's just it's a lot of technology that's available in our center. We do not only have a CyberKnife, we have a linear accelerator, we have a robotic surgery, we also have a CAR T. So when your patient comes to us, we will give them the best cancer care in the world. All right. So I don't know. I hope I answered you guys' question. Okay. And again, later on, you could always we could always get in touch with each other and continue to answer your question.
Yes, thank you, Dr. Yang. Okay, so let me answer that question now. For the cost issue, right? treatment cost in China is usually lower compared to Malaysia. But most important thing is CyberKnife is not just about the machine. Doctors' experience plays a huge role in achieving the best result. And Dr. Yang's team is definitely #1 in the world in using CyberKnife. So thanks again, Dr. Yang, for the very interesting and informative sharing. It's not dry at all. It's very interesting. So if there's no further question, we'll wrap up today's training. Thank you everyone for joining. But before we end, can everyone just turn on your camera and let us take a quick group photo together with Dr. Yang.
Excellent.
Open your camera.
Wow, we have so many people. So good to see everyone.
We have 31 members online together with us.
Excellent. So good to see everybody's smiling faces. Excellent.
We hope to see you offline soon. Face to face.
Yeah,
Okay,
let's meet in
guys,
person.
Yeah. Guys, open up your camera. Let's take a group picture together. All right, good. Everyone ready? Dixon ready for the group photo screenshot? All right.
Wow, all the good-looking girls and handsome boys.
Let us put a thumbs up together. 1, 3, 2, 1. All right. Thank you, Dixon. Thanks, Dr. Yang. And thank you
Thank you,
everyone
everyone.
for joining us. Thank
谢
you.
谢，谢谢，Thank
谢谢
you。
主任。
谢谢大家。
OK，
辛苦了，
拜拜。
杨博。
好，谢谢。
辛苦
谢谢谢谢。
Thank you，拜大家。
Okay, Ibrahim, very
Right.
good section. Good
Thank
start.
you, thank you. 哇，Dr. Yang 的魅力太有魅力哦，爱上好。
WellAgain, Total Healthcare Solutions.